Hello and welcome to Weil Foot and Ankle Institute webinar series. I'm Lowell Weil Jr. I am part of the Weil Foot and Ankle Institute. I'm board certified by the American Board of Foot and Ankle Surgeons in both foot surgery as well as reconstructive rear foot and ankle surgery. Today, I'm going to be talking about hammertoes. What are they and what can I do about them? You know, it's very common in my life that I get patients who come in asking me, what is this problem, hammertoes? Or I get calls from friends and family members or emails from our website. And in the rare occasion that I'm at a dinner party or a social gathering, and people will say to me, what exactly are hammertoes? And will you look at my toe and will you tell me, do I have a hammertoe? Well, today, let's talk about some of those things. Let's talk a little bit about the problem. It's commonly known as hammertoes or claw toes. And there are a subtle difference between the two, but many people will think that it's one and the same. A hammertoe is the bending of one of the joints in the toe. And it's usually the toes, not your big toe, the second, third, fourth, or fifth toe, not your big toe. And so when one of the joints bends, and it's usually the middle joint in the toe, that is called a hammertoe. And you can see the picture right here of that middle joint bending. A claw toe is when both of the joints in the toe bend, and then you get what is called a claw toe. So it's two of the joints that are bending in the toe. Again, it's the second, third, fourth, or fifth toes and not really the big toe. And so when those two things occur, people will have pain and problems associated with that. What are the causes of a hammertoe or a claw toe? Well, really, there's several different areas that causes these things. The most common is a muscular imbalance and the pull of the muscles and tendons within the foot and in the toes. So in this particular picture, this patient or this person's foot, the tendons on the top of the foot are pulling aggressively at one part of the toe, and the tendons on the bottom of the foot are pulling in a different way. So that causes the toe to gently bend, and then you can see the knuckles bending and sticking out like you're seeing in this picture. Another common cause of hammertoes or claw toes are the length of a person's toes. And this is a perfect example. If you look at this person's left foot, the second toe is much longer than the first toe. And when that happens, most shoes are designed for the first toe to be the longest. And when people start to get into those shoes, the second toe is pushed in a way that allows the tendons and muscles to pull in such a manner to accentuate the bend in the toe. And when that happens over a long period of time, the toe bends more and more and more, creating the positional abnormality that you're seeing in this picture. And then I alluded to a moment ago, shoe gear. If the shoes aren't fitting properly and the toes are scrunched or the toes are pushed to bend more aggressively, that will start to influence the bend of the toe, and then the muscles will pull in the manner that I talked about a few minutes ago. And that will ultimately lead to a hammertoe or a claw toe. Contributing problems besides what I just talked about are bunions, flat feet, high arch feet, and a previous injury. So let's talk about those one at a time. In the pictures here, I'm showing a bunion influencing a hammertoe. And what happens with a bunion is the big toe changing position. And as the bunion occurs, the first toe will start to take the position of the second toe. And when that occurs, the second toe will bend to get out of the way of the bunion. And so the bunion will actually influence the development of a hammertoe. Flat feet create a muscular imbalance in a way that cause hammertoes or claw toes to form, as do high arch feet. And I know that those are totally opposite, high arch and flat feet, but the muscular pull in each of them pulls in a different manner that can ultimately lead to a hammer toe, but the treatment of those are slightly different, whether you have high arch feet or flat feet. And I will commonly hear of people who have had a previous injury, a fracture of a toe or something like that actually influenced the position of the toe that led to a hammer toe or claw toe down the road after the injury. So when you get those types of things, and before we talk about treatments, common complaints are my shoes are rubbing on the top of my toes, I'm getting corns or calluses, and you may not even know if you have corns and calluses, that's really the underlying cause is actually a hammer toe or a claw toe. Sometimes people will have pain in the ball of their feet secondarily to the development of a hammer toe or claw toe. So there's a variability of the symptoms that will come from getting a hammer toe or a claw toe. So let's jump into treatments. In the early deformity, when toes are still flexible, and what that means is you could actually touch your toe and straighten it out completely, one could utilize manual manipulation. And what I mean by that is you could actually take your toes and you could stretch the toes out in a straight manner, just like you were stretching any other muscle or tendon in your body. So you could gently stretch out your toes regularly in order to maintain that flexibility so the toe doesn't become stiff in that bent position. Additionally, when the toe is still flexible, you could cushion your toe. And there are different devices that you can purchase, whether that be at a pharmacy or online, or if you wanted to come to a medical retail location like we have, there are these different cushions that you can put on your toe so that when you're wearing shoes that irritate those bumps and lumps, it's not so uncomfortable. There are also things that we call strapping of toes, where you can actually put devices on your toes that pull your toe into a straighter position. And these are two examples that actually help hold the toe in a straighter position. And these, again, can be bought sometimes at pharmacies, online, or at a medical retail store like we have. When these are worn, they're typically worn when you're weight bearing, meaning when you're on your feet, wearing your socks and your shoes, it will help hold the toe in a straighter position. And it may not only straighten out the toe, it could slow down the progression of the deformity to prevent it from getting worse as time goes on. Other things that you should really consider when you're having these problems are more comfortable shoes. Like you can see here, a gym shoe that has more depth and width, as well as open-toed sandals when the weather's appropriate. Because when you're wearing open toes, it isn't rubbing on the top of the toes or the tips of the toes. They are commonly associated with discomfort. So switching into some of these types of things can be beneficial and help some of the early pain that you might experience. When the problem becomes more advanced, and when I say more advanced, is those toes that I talked about being flexible are not so flexible anymore. When you try to straighten out the toe, it doesn't straighten out. It stays bent permanently. And there are different degrees. It can be really, really bent, or it can just be slightly bent, but it can't be fully relaxed in a straight position. That's when your problem is more advanced. That's when you have to look for a much more comfortable shoe with a much deeper toe box and a much wider toe box to accommodate for that toe that won't bend. And so you might find those shoes being less attractive and less fashionable for what your overall desires are, but those are the types of things that can make you substantially more comfortable in this situation. And when the deformity gets stiff, and if you don't like those shoes on the previous slide, then surgery becomes an alternative. It's certainly not a have to do. It could be something that, hey, you know what? I've had these hammer toes, these claw toes for some time. I've tried some other shoes. I don't like the way they work. I don't like the way they look. That might be a time that you would consider surgery. So when you have these problems, surgery becomes a very legitimate option. And surgery for hammer toes doesn't have to be a really intense undertaking. However, when surgery is considered, typically bones and joints have to be realigned or removed. And when doing that, Sometimes joints are removed to hold the toe into a more straight position. Sometimes things need to be put on the inside of the toe, like pins or special metallic devices to hold the toe straight. And those metallic devices aren't something you would see except in an X-ray, but they can hold the toe straight in a permanent situation. In these pictures, these are examples of people who have just hammer toes without other problems associated. In the next picture, I'm showing you people who have bunions associated with those hammer toes. And in these situations, it's probably going to be necessary, if surgery gets considered, that the bunion needs to be corrected at the same time as the hammer toe. Because let's look at the picture of the one of the painted toenails. If one were to just fix the hammer toe, there wouldn't be room for the toe to sit straight. So you would actually have to correct the big toe and the bunion to give enough room so that hammer toe could be fixed into a straight position. Otherwise, you're going to lead to other problems and ultimately not a complete resolution of the problem. When hammer toes are fixed, you would need to consult with a surgeon and listen to what is the combined problems with your feet, and the surgeon will be able to assist you in deciding what is the best surgical procedure to go through and what the recovery is involved. Typically, the recovery is not terribly substantial when we're just talking about a hammer toe. You might be in a surgical shoe for a week to several weeks, then leading back into a gym shoe, and then back into all the shoes you want to wear. Somewhere between 4 and 8 weeks after surgery is pretty typical. However, there will be some swelling that will last for many weeks beyond that, although that isn't necessarily associated with pain. Toes take quite some time to get rid of the swelling. But you could also return to your physical activities much quicker than most people anticipate. You could exercise usually on a stationary bike within a week or two after surgery, and then weight-bearing exercise could resume somewhere between 4 and 8 weeks after surgery in most situations. When you start to correct the bunion at the same time, the recovery may be a bit longer. So if you're thinking about, hey, do I have a hammer toe? Hopefully this has been helpful for you to identify the problem that you have. Or if you have friends or family, you can shed some knowledge on them, and you can be the authority in your household going forward. If it is something that is bothering you and you want to get a consultation and start living a pain-free life, our 20 locations have board-certified doctors who can help you evaluate your individual problem and then help you start to determine the best ways to move forward. And you can call and make an appointment at 847-390-7666, and one of our helpful representatives can direct you in the right direction. So I want to thank you for joining us today, and hopefully you found some value to learning more about hammer toes and claw toes. And we'd also love to hear back from you, just to give us some feedback on this particular webinar, or maybe other webinars you'd like to hear about pertaining to foot and ankle care. And you can go to webinars@weilforfeet.com and give us some feedback and some information. We'd, again, love to hear from you. I'd like to open it up to any questions that we might have from the audience today.
Hi, Dr. Weil. I was wondering, does physical therapy help with hammer toes, considering the correlation in some cases with flat feet or high arched feet?
Yeah, so thanks for asking that. Well, at the very beginning, I talked about some of the treatments which were stretching out the toes. That may seem super easy, but sometimes it helps to get a physical therapist who can help show you the right techniques to stretch out the toes. And also, I didn't talk a ton about this in the webinar, but sometimes weakness in the feet and toes can lead to the development of hammer toes. So visiting with a physical therapist can teach you strengthening techniques for the muscles in your feet and the muscles in your legs that go into the feet. what's really interesting is that our feet muscles are really, really weak muscles. They're not nearly as strong as our hand muscles, and we neglect strengthening them. So working with a physical therapist can, in fact, help stop the progression, or maybe at least slow down the progression of the problem.
Thank you. I actually do have one other question. Do you notice, or have you seen that athletes or children are presenting with hammertoes very often?
Sometimes we will see young children, even, from an early 1 or 2 year old child. In the event that you have a very young child, there are specific splinting techniques that can be utilized on a child to encourage the toes to grow in a more straight position. And that is a splint that needs to be applied regularly and sleeping, and then it needs to be remade regularly, because as the child grows, that splint has to be regularly changed. Athletes are no more prone to developing hammertoes than non-athletes. I would say that athletes might hurt more because many of the athletic shoes, especially in the cleats and things like that, are less give less space, and so we'll see a lot of athletes who will maybe present earlier in their deformities than other people who have more of a chance to move into roomier shoes. But any kind of person, athlete, non-athlete, tall, short, fat, thin, can develop a hammertoes.
Great, thank you.
I want to thank you for joining us today. I'm sure many of you are listening have other questions, and you may not be listening live. You might be listening in a recording. I'd encourage you to contact us, and one of the great team members of Weil Foot and Ankle Institute can help you. So thank you for joining us today, and I hope your feet are healthy, and if not, we're here for you.